This is Selma Schimmel, and you are looking live at the great city of Chicago, which is once again playing host to the American Society of Clinical Oncology, ASCO. This is ASCO's 49th annual meeting, and this year's theme could not be more appropriate: Building Bridges to Conquer Cancer. More than 30,000 of the world's foremost cancer specialists are here, and so is the Group Room, making our 15th appearance at ASCO and one of our very best. Joining me now is Dr. Allyson Ocean, Associate Professor of Medicine at the Weill Medical College of Cornell University and Medical Oncologist at the Jay Monahan Center for Gastrointestinal Health in New York City. Hello, Dr. Ocean.
Thank you for having me.
Let's start with the clinical part of our discussion.
Sure.
And pancreas cancer. Tough cancer.
Very. It's very hard to treat patients with pancreatic cancer because when they come in my office, you know, I know they don't know yet because they've just been faced with this diagnosis, and they may hear all bad things about it and poor survival, etc. But there's so much about the symptoms that patients experience and all of the side effects of medication that is part of their journey that is very hard to manage, and they don't even know that yet. So as an oncologist who treats patients with pancreatic cancer, in addition to trying to do everything we can to extend their survival, we have to do everything we can to improve their quality of life during treatment.
Let's backtrack a little bit and help our viewers understand the role of the pancreas.
The pancreas is an organ in our body that helps in the digestive system to basically digest our foods. So it secretes enzymes that help break down foods, as well as insulin to help with glucose management in the body. So it does two functions. It's a very important organ, obviously. When there's a growth in the pancreas of the mass of the cancer, the normal functions of the pancreas cannot be done. So therefore, people run into issues with problems with digestion, actually pain, because there are nerves that are right near the pancreas, and when the cancer affects those nerves, patients get back pain. It's very painful, as well as issues with glucose metabolism.
What are the initial symptoms, early symptoms that a patient might experience?
For the most part, this is a cancer that is diagnosed at its latest stage, and people really don't know they're sick until it's, quote, too late. That means it's already spread at the time of diagnosis. So the most common initial symptoms that people have are weight loss and back pain. Sometimes patients whose tumors affect the head of the pancreas, which is near the bile ducts, that they can present with jaundice or yellowing of the skin. That's not actually usually painful, but their skin turns yellow, their eyes turn yellow, and that's a sign that there's a blockage there in the ducts.
Who's at risk, and what's the age where you tend to see patients being diagnosed?
The only known risk factors for pancreatic cancer are family history, also smoking. So those are the two main established risk factors. The age of people that is usually affected is usually in the decade of the 60s, but it can happen to very young people or even older, but it's usually anywhere from 50s to 70s.
Thank you, Dr. Ocean. Dr. Allyson Ocean, Associate Professor of Medicine at the Weill Medical College of Cornell University and Medical Oncologist at the Jay Monahan Center for Gastrointestinal Health in New York City.
Thank you.
Nice to see you again.
Nice to see you too.